Your Humanities Half Hour is brought to you by the Northern Marianas Humanities Council.
Zantero. Welcome to Your Humanities Half Hour. I'm Catherine Perry, and today we are talking about anxiety. And our guest is psychiatrist Michael Chen. Dr. Chen, welcome to the show.
Hi, thank you for having me.
Thanks for making time to talk to us about anxiety today. It's kind of a catchphrase. A lot of people are talking about having anxiety, especially with COVID-19. Maybe you can start us off with what exactly is anxiety?
Anxiety is when people have fear. So it's the same worries that you get when a shark is chasing you or a wild boar is chasing you, but it's not there. It's out of proportion. The scary thing that you think might be there isn't really going to harm you that badly, is not as severe or kind of out of proportion to what you think it is. And sometimes your body shows it up. Your body will kind of sense it too.
So it's like it's being fearful, but being fearful at a time where you don't need to be that fearful, if I understand what you're saying.
You're right.
All right. So what are some of the ways anxiety manifests itself, either physically, emotionally, mentally? Because honestly, I think a lot of people may be feeling weird and they may not actually know that it's anxiety. So how can we identify this in ourselves?
Sometimes, most notably, people notice that their heart beats faster, they start breathing faster, a little bit shorter breaths. People can sometimes feel like their fingers get numb and their toes get cold. And sometimes people talk about those as kind of panic symptoms or having a panic attack. But you'd also have other types of physical symptoms of just muscle aches and fatigue, or just feeling run down and tired, or restless. Just like you can't sit still and you're moving around a lot. Just like go along with the worries and the anxiety.
And I'm sorry. Like, what about kind of the thought process a person might have if they have anxiety?
Sure. Sometimes people describe their thoughts are kind of racing, jumping from one thought to another, from one worry to another, and they get faster and faster and faster. Kind of like rolling down a hill. You have one thought that leads to the next worry, that leads to the next worry. They get faster and faster. Then it gets hard to do whatever else you're trying to do.
Mm-hmm. Is there any particular symptoms of anxiety in relationships, like the way a person may relate to another, like normally or often relate to other people, that may be symptomatic of anxiety?
Sure. In terms of other people, sometimes people will withdraw or kind of stay away from other people.
Really?
Or they'll try to avoid whatever makes them scared. Some people have social anxiety where being around other people, like going to the store, is just scary. Checking to see that if there are too many cars out of a store, they won't go in. They won't go with their spouse, their family, other people. They'll just stay in the car because there are too many people. There'll be family gatherings that they won't go to, because there's too many people there. These are people that they know. They know they're not going to hurt them. There's nothing there. It's just there's too many.
Not to be confused, I think, with introversion, where a person enjoys being by themselves, but it's a different kind of motivation for not wanting to be around people. Is there a difference? I mean, like I was saying, a lot of people are saying like they have anxiety, but is there actually like a clinical definition of anxiety versus just being anxious sometimes?
Clinical or anxiety disorder is when these thoughts and worries get in the way and they keep people from functioning well at work, or kids going to school, or functioning at home. Anytime where these are all the time, they get in the way for more than 6 months or so, and they keep people from going about their regular lives.
Mm. Okay, that's something I've heard before in my previous discussion with Dr. Demetrius, was that if it gets to the point where you can't normally function, that's when you know that you may need to seek additional assistance with whatever problem you're having. If you can function normally, then it's not so bad. But if it becomes like a inhibitor to your normal life, then you may have need additional assistance. Let me ask you. Let me go first. I know that I have had a panic attack. I happened to be, and it was so unexpected. I just happened to be driving home from work one day, and I was at the stoplight, and then all of a sudden I felt my heart beating really fast. This was like maybe 15, 20 years ago, and I don't know why I didn't think it was a heart attack, but for some reason I just said to myself, I'm having a panic attack, and I realized, I thought about it, like, why am I having a panic attack? I drive home from work every day. What's going on? And I realized I had been under a lot of stress at work for a long time. You're nodding. Would that have been a legitimate cause for a panic attack?
It can. Sometimes it doesn't always come to mind what caused it at the moment.
Yeah, I had to think about it later on.
And sometimes we call them triggers. Sometimes stress at work, stress from relationships, other things, that could be a trigger. You could be around other people. There could be triggers from kids at school or people at work. If you had an upcoming meeting or something with your boss or upcoming deadline maybe, those things can be triggers for it. But oftentimes, sometimes people that have panic attacks just happen out of nowhere.
Oh, okay.
They're not sure why. Their just heart starts beating fast, but not because you're running, not because you're actually moving around, but right, sitting at a stoplight or driving, and just suddenly your heart starts beating really fast. Sometimes people have breathing symptoms. They have a hard time trying to catch their breath. Other times they don't. They just happen. Some people have triggered ones. Other people have ones that just happen out of nowhere.
So what are some of the causes of having anxiety?
And with mental health, we always want to make sure we get rid of the other. We look at and consider other causes first. Things like herbal medications, prescription medications, then things like caffeine, marijuana, other drugs like methamphetamines, or even trauma. Sometimes people that have had really horrible experiences, those can bubble up when we don't expect them to. And also, importantly, there are also underlying medical issues. Sometimes people can have a heart attack. Sometimes you can have other medical issues going on. And oftentimes, going to the emergency room once or so, or seeing a regular doctor, they can figure out, no, really things are medically okay. And then we start looking at those other causes. And genetically, we find that maybe 30 to 60% of times people can pass it on between families. There's a 30 to 60% chance of, across several genes, of people inheriting it from family. So within the genetics, you can have a chance of an increased risk of having an anxiety disorder, but there are also some people that just never get it.
Could you tell us again those causes, and would it be helpful maybe if a person feels they have anxiety to or they're triggered, they have a panic attack, to kind of pause and reflect on maybe some of these causes to see if there might be if they might be able to have an idea about why they're feeling anxious. But yeah, would you mind telling us them again so that we can ponder that a little bit more?
Sure. There are things like herbal remedies.
In other words, like teas or something like that, or not necessarily
teas, roots, other things that may have
natural medicine.
Yeah, natural medicines and herbal medicines that may interact with things.
Okay.
Different cultural medicines.
Okay.
That may interact with regular prescription medications.
That's right, because the two don't always go together, and you kind of shouldn't mix the two if you're taking some kind of, or that's my understanding, correct me if I'm wrong. If you're taking like pharmaceuticals, you shouldn't necessarily take some kind of local remedy at the same time.
Some are okay. Just run it by your doctor, and they can look through different websites to see how they might interact. Some are perfectly fine with others. And you don't want to just stop a prescription medication without letting somebody know. Mm-hmm. Just so everybody's on the same page.
Okay.
And common things like caffeine. Sometimes people will feel their heartbeat a little bit faster if they've had a couple extra cups of coffee. Or sometimes people will smoke marijuana thinking that it'll calm them, but at a certain point, I've seen in many patients that we're not sure when, and they're still doing research on it when, that people will get panic attacks or more anxious when they smoke. We're not sure when. Maybe it's different strains or other things. I'm not sure, but sometimes that can happen. Sometimes it helps people calm. Other times it just makes them more anxious. And things like methamphetamines, we know, or ice, we know will make your heart beat a lot faster and people get more anxious too. And then trauma, people have experienced really bad things in their life. Times when they might have died, there was sexual contact that they weren't okay with. Those things can bubble up too. That can cause anxiety and fear, even though the danger is not there at the moment anymore. It may have happened years ago and it comes bubbling up. When something triggers things or reminds them of it, or it just pops into their mind even when they don't want it to. And then there are medical issues. Some people will have irregular heartbeats that their heart produces because of the electrical wiring. And that can be taken care of sometimes. That could be another cause too. We want to look at all these possibilities and kind of sort through them, but after those are all sorted through, then it kind of falls into mental health and anxiety. And along the way, it's good to have some of these ways to help manage it too. And we can get to that a little bit later.
Yes, we will do that. That's the good news, is that we're going to come back from the break and actually talk about some potential ways that people can either help manage their own anxiety and also some resources available if they need extra help. We're talking today about anxiety with psychiatrist Michael Chen, and we'll be back with more after this break.
I Northern Marianas Humanities Council, Bula Guinahanya puri historian Marianas dan kultura. Sinyon soda esisihan information gi zon mami website nmhcouncil.org, pat bisita gi YouTube, pat Facebook. Guahaloque diferentes clases leblu na sinya un fan. I Northern Marianas Humanities Council has uzura todo I experiencia tautau.
Did you know that you can donate up to $5,000 to the Humanities Council through the CNMI Education Tax Credit Program? Donations from individuals and corporations qualify and can be used to offset your local wage and salary tax, BGRT, and earnings tax. Call our office at 235-4785 to see how you can support humanities programs in our community and obtain a tax credit for your donation. Sizuus Maasi, Olomai, and thank you.
Welcome back to Your Humanities Half Hour. Our topic today is anxiety, and we're chatting with psychiatrist Michael Chen. Dr. Chen, I didn't get to ask, I didn't give you time to respond. Have you ever felt anxiety?
Sure, I felt a little bit worried sometimes. I get a little bit worried speaking in public, but it doesn't keep me from doing it. I'll still do it. I'll take a deep breath, relax, and think about it, prepare, and I'll go through it and do it.
Were you anxious about coming to our interview today?
Just a little bit.
Okay. Thanks for being honest. It's nice to know that even the psychiatrist, is human. What are some other situations that a person might feel anxiety?
Sometimes people feel like things are too crowded. When the teenagers went back to school, going from cohorts, I've met lots of patients that were happier going back in cohorts when the classes were half full because the classroom seemed about right. And then once everybody went back to full classes, they felt the room was too tight. There was too many people there.
And that's interesting because it's almost like you said, anxiety seems to be like excessive fear. So it's kind of, I feel for people in that situation where they're going into a situation where they just feel fearful just because there's so many people there. But it's nice to talk about it because then maybe some people don't understand what's going on with them. And having this discussion allows them to kind of say, oh, that's why I feel uncomfortable, or that's why I don't really, enjoy this kind of situation.
Sometimes people will be worried that other people will notice that they're worried. Some people are worried that they're sweating or that they're not able to focus or pay attention because, will other people notice that they're worried? Will people notice that they're not paying attention? Will somebody notice that they're having a panic attack? So there's an experience of having a panic attack, then there's a worry that when is it going to happen again? And also, will somebody else see it? Will somebody else notice? That is scary to some people. It's also, some people get frustrated that sometimes people don't understand why it seems scary. So it's a situation where somebody that has anxiety, it's scary to them. It may not make sense to them either, but it just is. In their body and their brain, it feels really scary. Sometimes in their mind they know nobody's really going to hurt them. Things are really okay, but they can't get over why their body and their brain tells them that's something you should be scared of. And then trying to explain that to other people gets people kind of down because they can't control their own bodies. They get sad about it. And sometimes there's a risk of depression and even risk of suicide with people with high anxiety.
Would it be helpful for a person to kind of reflect on and dig deep as to why they're feeling anxious? Especially if it's like a mental or a thought process that's making them anxious. Like, why am I anxious? Is that helpful?
Sometimes it's helpful, but it's good to do it with a guide.
Okay.
Finding a therapist, a psychiatrist, somebody to talk through with, somebody to sort it through as you dig it through, and sometimes knowing that there may not be a cause. It could just be your body just telling you to be scared of something that's not there.
Okay.
You may not be able to identify something, so finding the other skills to cope with it and deal with it are also really important, rather than trying to find the root cause of it when there may not be one.
Okay. Well, thank you for clarifying that. Let's talk a little bit about some of these other interventions or steps a person can take, habits a person can adopt to minimize their anxiety. One of the things I heard recently is the importance of really just like getting proper sleep and sleeping at the right time. Maybe you could start us off there.
Sure. Sleep is important. It gives us a chance to rest and relax. Also, for some people, it's a time when you're laying down, you're trying to relax, but then the worries creep up. You don't have your normal distractions to keep you from thinking about things. Some people with what's called Generalized Anxiety disorder, or a worry about things you could have done or should have done, those worries tend to creep up on people at night. Finding ways to relax, writing things down maybe to get things off your mind so you can do them later. Trying to stay off of your phone. We try to avoid blue light and phones an hour before bed, but it's really hard these days. Trying to be out of bed and doing nothing in bed but sleep. This way, if you're doing work or watching videos or something in bed, your brain's up and awake. If you're reading, a lot of times the old adage was read a book in bed before you go to bed. But it's easier if you're reading in a chair outside of bed or reading at the edge of your bed, and then when you're done, close it, go to sleep, and then go get into bed.
So it's kind of like getting your body into the habit of knowing that when you lie down in bed, you're going to go to sleep. You're not going to be reading, you're not going to be on your phone, but kind of getting your body used to that. Talking about the body clock and how the body works throughout the 24-hour day, the circadian rhythm, they say. Is there a recommended time to sleep or eat? Because, we can sleep and eat any time of the day now.
Sure. Try to keep a good sleep-wake cycle, if you're working a normal daytime shift, you want to try to go to sleep at night when it's dark, so you can be up after 8 to 10 hours of sleep. So try to get to bed at a good time. If you're the few that are working an overnight shift, when you get off work, they want to avoid bright sunlight in the morning so they can get home and get to sleep. Hopefully they've got their windows covered so it's nice and dark so they can sleep, so they can be up for their night shift later the next day.
Okay. Does diet play a role at all?
It can. Watching what you eat, limiting caffeine. For some people, having a cup of coffee at dinner is too late. Some people have their last cup at lunch or so. Other people can have it later.
I'll raise my hand. I have learned that as I've gotten older, that by 3 o'clock I need to stop drinking the caffeine. Not that I always comply with that, but I know that there's going to be a result. I'm sorry, go ahead.
Yeah, some people can't have it too late. Some people can. But knowing your body and when you can have it, watching energy drinks. Sometimes kids will drink them just because they taste good, or adults will. But they can keep you up if you have them too late. Things like pre-workout. People will have to have a little bit more energy, but those can also contain caffeine and other energy supplements, I guess.
Okay, that's good to be aware of. Now, I think most people know that exercise is good for our physical health, but can a regular exercise help with anxiety?
It can. Getting at least 30 minutes a day of good cardio exercise, raising your heart rate, if your doctor recommends it, moving around can be good. It helps your body relax a little bit better. Being able to get your heart rate up and be able to slow it back down again is what helps. Helps people to have control over their breathing and their heart rate. So when the anxiety hits, you can try to relax and slow it down. And we recognize it's really hard to do. It's a lot easier to say, oh, just take a deep breath, take a moment to breathe, than to do in the moment. In the moment, it's very, very hard to do. That's why it takes a lot of practice. It takes a lot of practice to slow down, to breathe, to be able to calm down a panic attack in the moment.
Speaking of breathing, do you think practices like meditation or mindfulness would be beneficial?
There's definitely research on mindfulness that mindfulness can be good. Helps people stay in the moment. And
what are some ways a person could practice mindfulness?
The different ways, from taking your pulse to the different apps that help people stay mindful, to something as simple as if you're holding something in your hand, or put something in your hand, kind of hold it, feel it, and focus just on that. Focus just on the sensation. Try to focus on what's going on and how you're feeling in the moment. And knowing the other thoughts and the worries will come up, but we can't control that they pop up, but we control how long we kind of focus on them. So just let them pass. Mm-hmm. Let the thoughts and the worries pass as you focus on maybe an object in your hand is easiest.
Or your breath a lot. When you meditate, they say focus on the breath. So it's like taking your thoughts away, pulling your thoughts away from the past, which is over. You can't do anything about it, and pulling it away from the future, which is uncertain. You can't control that either. And just being in this moment. Yeah.
That's definitely right. It's easier to stay in the moment with what you can manage, what you can do, and not to focus on the worries about things you could have done in the past, things that you can't change anymore, things that are coming in the future but that haven't happened yet, mm-hmm. and that you don't know how it's going to play out. Whereas in the moment, you can stay current, stay in the moment, you can breathe, you can focus on what you can do.
Mm-hmm. I find that one of the best ways for me to be mindful is to be out in nature. Because, there's so much beauty out there, and the wind and the sand beneath your feet, and the being in the water is a great way to just release a lot of stress, I find.
Yeah, we have a lot of that here, that you can be out on the beach, you can get your feet in the sand, focus on the waves.
Mm-hmm. You were talking earlier about trying to avoid using your cell phone or blue light before you go to bed. What role does social media play, if it does, in anxiety? I think there's a lot of talk about how social media can have a negative impact on your self-esteem because everything is, idealized. But is there a correlation at all with anxiety?
There can be. Some social media platforms, and there's a variety of them, they're programmed to kind of capture your attention and and feed you what you're interested in or what they think you're interested in. And right, as you said, a lot of things can be idealized. There are lots of filters on photos. There's a lot of things that can feed towards your anxiety. If you keep scrolling and swiping, it'll keep showing you different things that may rev up your anxiety. On the flip side, there may be some things that can be positive about it. Finding support groups, finding ways to connect with other people about similar situations. Can be good to note that you're not alone. That there are other people that have these symptoms. But getting treatment advice, it's still best to talk to a professional. Someone whose job it is to help you work through things, to sort through things. Who has the background in training.
Could you share with us where those resources are available here in the Marianas?
Sure. There are a couple programs through CGC, the Community Guidance Center. There's the Systems of Care program. There's the Wellness Clinic. And there's also the Garrett Lee Smith suicide prevention if things get moving in that direction. We also have there are some private psychologists on the island as well. Some that take insurances, some that may take Medicaid. CGC runs through grant support, so insurance doesn't enter into it. There's some programs for school-age kids at PSS. There's some programs there as well.
Okay, great. So a lot of ways that people can reach out if they need that extra help. I really want to thank you for sharing about this topic with our community. You know, we talk a lot about physical health, but mental health is also very important, of course, and related to physical health and related to emotional health. Any final thoughts before we go?
That we're here at we're over there at CHC at the hospital. We've got psychiatrists there, and we're connected to CGC in the community. So therapy's out there. Psychiatrists are here in case medications are necessary. And that people aren't alone, and that we're here to help.
And thank you for helping us understand it a little bit better. Thank you.
Thank you for having me.
Our guest today has been psychiatrist Michael Chen. We've been talking about anxiety, its causes, its symptoms, and most importantly, where you can get help and some tools that we can use ourselves if we suffer from anxiety. This has been Your Humanities Half Hour. I'm Catherine Perry.
Your Humanities Half Hour is a production of the Northern Marianas Humanities Council, funded in part by the National Endowment for the Humanities. Any views, findings, or recommendations expressed in this program are those of the participants and do not necessarily represent those of the National Endowment for the Humanities or the Northern Marianas Humanities Council.